Beware of RSV, yeah you know me, warns the CDC. On Thursday, the Centers for Disease Control and Prevention, CDC, issued health advisory about a familiar foe, RSV, which is short for the respiratory syncytial virus. This virus seems to be now spreading throughout various parts of the southern US. The CDC is calling this increased interseasonal RSV activity, because June ain't usually RSV season. Instead, RSV activity typically tends to pick up during the fall and winter months and fall in the spring, similar to cold and flu viruses. But something was different about this past fall and winter compared to previous falls and winters. What could it be? Was it the return of McDreamy to the TV show Grey's Anatomy? The appearance of Harry Styles on the cover of Vogue? The spread of the elf on the shelf meme on Instagram? Well, those probably would not have prevented the spread of RSV. No, the difference was something called the COVID-19 pandemic and the precautions that people have been taking, such as wearing face masks and staying 6 feet or 1 Denzel, because Denzel Washington is about 6 feet tall, apart from one another. Such COVID-19 coronavirus precautions may have kept other respiratory viruses such as RSV at bay since the start of the pandemic. Indeed, based on data from the National Respiratory and Enteric Virus Surveillance System, NREVSS, RSV activity plummeted in April 2020 and stayed low until late March 2021. But now that people are saying precautions, schmecautions, due to being vaccinated against COVID-19, pretending that they are vaccinated against COVID-19, or not caring about COVID-19, RSV may be saying, here's our chance to spread, even though it is technically the off-season for RSV. Indeed, over the past 2 months or so, NREVSS has shown an increased number of RSV cases, particularly in states that comprise the U.S. Health and Human Services, HHS, Region 4, Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee, and Region 6, Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. This isn't good because RSV is not a happy, fun virus that causes giggles and joy. Quite the contrary. About 4 to 6 days after exposure to this RNA virus, you typically will suffer 5 to 7 days of upper respiratory tract infection symptoms such as a fever, headache, runny nose, sore throat, cough, and fatigue. Of course, not everyone infected with RSV may have symptoms. Worse things can happen though, especially in younger children or older adults, whose immune systems aren't quite as strong. In fact, RSV is the most common cause of bronchiolitis, which is an inflammation of the airways in the lungs, and pneumonia in children under 1 year of age in the United States.